In the land of abundance, a silent crisis has been growing, one measured not in economic numbers, but in waistlines, hospital admissions, and shortened lives. The United States, a nation known for its innovation, prosperity, and global influence, is also home to the highest obesity rates among developed nations. Today, more than 42% of American adults are classified as obese. Among children, nearly 1 in 5 falls into the same category. These are not just statistics, they are lives, millions of them, shaped by food, environment, and culture. But how did the most powerful country in the world find itself in the grip of a health crisis that is shortening lives, draining billions from its healthcare system, and redefining the very fabric of society? This is the story of America's obesity epidemic, how it began, why it persists, and what it means for the future. To understand obesity in America, we must look back. In the early 20th century, food scarcity was still common. Families valued calories as precious. Malnutrition was the concern, not excess. But after World War II, everything changed. America became a land of plenty. Advances in agriculture, refrigeration, and food processing made calories cheaper and more abundant than ever before. The rise of fast food chains in the 1950s revolutionized eating habits. Hamburgers, fries, and sodas became symbols of American culture, quick, convenient, and affordable. By the 1970s, processed foods lined every supermarket aisle, brightly packaged cereals, frozen dinners, and sugary snacks. It was the beginning of a new relationship with food, one where taste, marketing, and convenience triumphed over nutrition. In 1971, the average American consumed about 2,200 calories per day. By the early 2000s, that number had climbed to nearly 2,700. What changed was not just the amount, but the type of food. Added sugars, refined carbohydrates, and unhealthy fats became staples of the American diet. Sugary beverages, once an occasional treat, turned into daily habits. Today, the average American consumes over 17 teaspoons of added sugar every day, far exceeding recommended limits. The shift wasn't accidental. Food corporations engineered products to maximize cravings, using salt, fat, and sugar in precise combinations to hook consumers. Marketing campaigns targeted children with colorful mascots and catchy slogans, creating brand loyalty before they even learned to read. The result, a population gradually conditioned to overeat, and to prefer foods that fuel weight gain. Obesity is not just about appearance. It is a gateway to some of the most devastating chronic diseases of our time. Excess weight increases the risk of type 2 diabetes, heart disease, stroke, sleep apnea, arthritis, liver disease, and certain cancers. The toll on the healthcare system is staggering. Obesity-related illnesses cost the United States an estimated $173 billion every year. And the crisis is not just physical. The emotional burden of obesity, social stigma, discrimination, and mental health struggles, cuts deeply into the lives of millions. Perhaps most alarming is its effect on children. For the first time in modern history, today's youth are projected to live shorter lives than their parents, because of obesity. The obesity epidemic is not evenly distributed. Poverty, race, geography, and education all play roles. In low-income communities, fresh produce is scarce, while fast food is cheap and abundant. These so-called food deserts leave families with little choice but to rely on calorie-dense, nutrient-poor meals. Meanwhile, relentless advertising pushes sugary cereals, candy, and soda disproportionately toward children and minority groups. Studies show that Black and Hispanic Americans face significantly higher obesity rates compared to white populations, a reflection not of genetics, but of inequality in opportunity, environment, and resources. Obesity is not simply a matter of individual willpower, it is woven into the social and economic fabric of America. Childhood obesity has tripled since the 1970s. Today, 1 in 5 children in the United States is obese. Schools once played a protective role, but decades of budget cuts removed physical education from many curriculums, while cafeterias became filled with pizza, fries, and soda. Even the lunchroom became an extension of the fast food industry. Screen time has replaced outdoor play. Children spend hours on phones, tablets, and video games, while neighborhoods often lack safe parks or sidewalks for exercise. The consequences are profound. Obese children are more likely to develop diabetes, joint problems, and emotional struggles early in life, conditions that often persist into adulthood. Behind the obesity crisis lies a powerful force: the food industry. Over the past half-century, corporations have poured billions into lobbying against regulations, sugar taxes, and clearer food labeling. Marketing budgets dwarf those of public health campaigns, ensuring that junk food dominates airwaves, billboards, and digital platforms. When scientists began warning of the dangers of sugar, internal industry documents revealed a coordinated effort to shift blame toward fat instead. For decades, Americans were told that fat makes you fat, leading to an explosion of low-fat but sugar-loaded products, ironically worsening the epidemic. In this environment, making healthy choices is not just a matter of discipline, it is a daily battle against powerful forces designed to exploit human biology. The government has tried to respond, but often with limited success. Food pyramids and dietary guidelines shifted over the decades, often influenced by lobbying more than science. School lunch programs introduced healthier options, but funding shortfalls and pushback from industry weakened their impact. Cities like New York attempted soda taxes and portion size limits, sparking fierce debates over personal freedom versus public health. Meanwhile, programs promoting exercise and nutrition education struggled to keep pace with the scale of the crisis. The obesity epidemic reveals the limits of individual responsibility in a system shaped by policy, industry, and economics. What lies ahead? If current trends continue, by 2030 nearly half of all American adults may be obese. The financial burden could cripple healthcare systems. The human cost, shortened lives, lost productivity, and diminished quality of life, is incalculable. But there is hope. Grassroots movements, community gardens, urban fitness initiatives, and digital health apps are gaining traction. More Americans are questioning the food they eat, demanding transparency, and seeking balance in their lifestyles. Medical advances, from new weight loss drugs to bariatric surgery, offer tools for those struggling with severe obesity. Yet without broader changes, in culture, policy, and environment, these solutions can only do so much. The story of America's obesity crisis is not just about food. It is about economics, culture, politics, and identity. It is about a nation that, in its pursuit of convenience and profit, forgot the cost of abundance. And it is about whether America can summon the collective will to reclaim its health. The scale reads more than pounds. It reads the weight of a nation's choices, and the future of generations yet to come.